My name is Louise Maunick and I'm a Chief Pharmacist at South Central Ambulance Service. I'm also a member of the Ambulance Pharmacy Network, of which all trusts have representatives at the network across the UK. And as part of that role, I am one of the members of the Ambulance Pharmacy Network that is also a member of the JRCALC Committee. And within that role, I've been supporting the review of the medicines included in the 1.24 JRCALC Clinical Update. What we've done is we've revised the style of the monographs in that update. And we've agreed a standard to move forward where all monographs will follow that style. It's going to take us a bit of time to get those new monographs sorted out. So within this update, you'll see that syntometrine and misoprostol have been updated in accordance with that new style. We updated the monographs in response to suggestions made by users. We wanted to standardise all the medicines in JRCALC to make it easier to understand the monographs and reduce the risk of errors, and include relevant information such as pregnancy and breastfeeding advice, so that appropriate information can be given to patients so that they can make either informed decisions about medicines before they receive them, or if in fact you've administered an emergency, be able to provide them with advice following on from administration of that medication. So the aim is to keep the key information easily accessible for emergency treatment, but also provide you with a more detailed monograph so that when you need to look up more details, you do have that information available. So there is the quick look section, which contains the key information that you need in an emergency, but then there is also the detailed monograph, so that you can go to a specific section that you need. For example, you're treating a breastfeeding mother, you needed to administer salbutamol to them. After the emergency treatment, the mother asks you what to do about feeding the baby. You can now look to that specific section in the monograph about breastfeeding and give the mother advice about whether they are safe to continue breastfeeding and what they need to do in terms of looking after their baby. And that means that if you're leaving the scene, for example, the breastfeeding mother is going to feel comfortable post that treatment and knowing what they're safe to do moving forward. We also considered how to lay out the monograph in the future, and we'd had a lot of feedback about the fact that people are using PGDs and they were a different layout to the JRCALC monograph. So we've used the national PGD template and aligned the JRCALC monograph to that national PGD template to make it easier to switch between the two different sorts of guidelines that you might be using as your option to administer the medication. So first of all, syntometrine and misoprostol have undergone full reviews and are the first medicines that are being updated with the new standardisation model that's being introduced to JRCALC. The second part is that in the medicines overview, the new wording has added on displacement values, slight amends to benzyl penicillin to take into account displacement values. Now, for those of you that don't know what a displacement value is, essentially, the easiest way to explain it is you have a jug of water and you put something in, like a stone, for example, it automatically rises the level of the water and means there's a greater volume in there. If that is a liquid or a powder, that increases the level. And when you're using it as a drug, that means that it changes the dose that you need to give for the treatment. So what we've done is accounted for that within the guidelines to make sure that the dose that you're giving to your patients is accurate. The Ambulance Medicine Safety Network review medicines errors in our trusts. And this year, for Medicine Safety Week, they chose to focus on reducing administration errors and produced a poster supported by ACE promoting the 6 rights of administration. So the 6 rights are right reason, right drug, right dose, right patient, right route, right documentation, and double checks. Reducing harm due to medication errors is a global initiative driven by the World Health Organization. Globally, the cost associated with medication errors has been estimated to be $42 billion annually. not to mention the impact on patients themselves. So it is really important that we support this as an ambulance network, and that we try and drive initiatives to reduce harm to patients. We've received a query about if hydrocortisone could be given in a cardiac arrest. We looked at this one and decided that a new indication has been added, that it can be considered in post-ROS patients that may have arrested due to adrenal crisis. And this can be given via the intravenous or intraosseous route. Due to a number of reported errors with diazepam, we have decided to split the rectal route from the injectable diazepam on the app. These will be split into two separate tiles, one for rectal diazepam and one for diazepam for injection, so that two different presentations of the drug are more easily identified. And we hope that this will help reduce errors. It also links to the fact that some trusts, we are aware, use a PGD for some forms of diazepam. So it enables them to be able to use the JRCALC monograph and use the PGD for the section that they want to use, rather than staff getting confused with which one to use for which section. In patients that are bleeding due to trauma, we've updated tranexamic acid monograph to confirm that first-line administration can be either intramuscular, intravenous or intraosseous routes, and that the priority is that the tranexamic acid is administered as soon as possible by whatever route is needed. Just to give a bit of background to this, nationally, there is a review underway post-Manchester inquiry looking at tranexamic acid, and the importance of quick administration was highlighted. We have had some concerns raised that currently, where staff are waiting to obtain an intravenous route, there are delays in administration of tranexamic acid. So this update was about promoting the fact that any of those routes are acceptable routes to get it, and that the priority is to get tranexamic acid into the patient as quickly as possible. So we are constantly monitoring the queries and suggestions that we receive in relation to medicines from users, and hence we have made changes to improve the usability of the app and the information available regarding medicines. It is hoped that these updates will help make the app more usable to staff in the clinical environment. And we do value feedback from users, so do let us know your thoughts, particularly as these new standardisation changes are being made. We really value feedback, good or bad, regarding these new monographs, to see if they work in the clinical environment and they are working for you.